number one, of course, would be the question of safety, which I omitted from my previous answer. In general, the potential adverse effects from acetylcholinesterase inhibitors are pretty well known. Hypersalivation and activation of gastrointestinal activity, nausea, all of these are to be expected to be easily manageable, but we need the completion of clinical studies to assess how this plays out in real life. Another important question that relates to the two previous questions is there are already a lot of other anti-acetylcholinesterase inhibitors around. Don't they also act as anti-seizure drugs? Well, they have been tested and shown that none of them really has comparable anti-epileptic activity to Huperzine A. So Huperzine A really is very specific, highly specific for CNS acetylcholinesterase, and thereby it has this very specific effect. We also expect as a potential side effect of the clinical use of Huperzine A that it might support cognitive action and memory, since cholinesterase inhibitors typically are used as medications against dementia, and also that's the original use of this club moss Huperzine serrata in Chinese medicine, from where this plant-derived drug was originally taken from. Furthermore, of course, prior to general clinical use, the clinical efficacy has to be further defined. So the clinical studies have to be completed. Phase 2A already has been promising, and now there are preparations for Phase 2B in larger patient samples and for a longer duration, as well as then a global program for a Phase 3 testing. And after these data are in, which should be expected in a few years, we're hoping that Huperzine A can be registered and approved for clinical use and application.